Good afternoon. My name is Claudia Louro, and I'm the project manager of PROCARE4LIFE, and I would like to thank the vCare consortium for the opportunity to be here sharing our achievements. So let me introduce you. Can you move the slide, please? So let me introduce you our PROCARE4LIFE project. PROCARE4LIFE is an innovation action funded by the Horizon 2020, a 3 years project, which aims to contribute to the improvement of older adults' quality of life and better manage of their condition through a personalized integrated care solution. The consortium is constituted by 14 institutions from 6 different countries, and it stems from the end user organizations such as patient association, public hospitals, private clinics, industry, research and SMEs, and a non-profit foundation. And the knowledge and the expertise of the consortium ensures the success of this project. Can you move? I have a video to show. I hope this works. It's an animation video in the next slide. It's embedded in the presentation. Can you click? See if it works.
No video. No,
It's embedded in the. It should be embedded in the presentation. But anyway, if it's not working, never mind. It was just to give us, yeah. So it was just a way to give us an overview of the project, and it will goes through our Maria's patient and through the care and through all the stakeholders, all the players, users that are involved in the solution. But okay, since we cannot see the video, let's go and have these summarize the key innovative aspects. I think it will be a little bit more difficult to overview the project, but anyway, we have here these four key elements: the integrated care solution, where we involve all the key stakeholders. We have the citizens, in our case, the older adults with neurodegenerative diseases such as Parkinson's disease, Alzheimer, and other dementias, but it's also tested in chronic diseases. But we have also involved carers and different health and care professionals. This solution wants to provide users with the information needed to use to ensure a better quality of life and the disease management. Another aspect of our another key innovation aspect is the artificial intelligence at the service of the users, which will enable not only to detect and monitor the evolution of their condition, but also to generate data-driven recommendations for patients to improve their daily life activities and prevent the progression of the disease. This will lead us to the third key innovative aspect that we have here, which is the personalization. Since personalization is one of the key words of the PROCARE4LIFE, and which based on the information that is gathered from the sensorial ecosystem that you cannot see in the video, and the interaction with the system and the profile and the artificial intelligence algorithms that will process the information and will enable personalized interaction. And to close these innovative aspects, we have the integrated care pathway model, which we planned and designed an integrated care pathway model that wants to contribute to improve the quality of the healthcare and the continuous delivery of care services involving all the stakeholders. And we have done it in 5 steps. First, we understood the user needs and requirements. Then we analyzed each individual care pathway of the end users involved in the projects. Then we designed the consolidated care pathway, and we planned a step-by-step implementation strategy. And in the end, yes, it's okay. And we adapt the PROCARE4LIFE use case to other digital solutions. Can you pass now to the next slide, please? So regarding the acceptance, PROCARE4LIFE solution has been designed and optimized using a user-centered approach. I'm not saying patient, I'm saying user, as someone said previously, is not only centered in the patient, but all the users involved, and how we have done it. So these projects relies on results from previous projects, even if we had to develop a lot of things here in this one, but we learn from what we were able to do from previous projects. We had in a project a study that we conducted to have the needs and the requirements definition. Then during the same time we will brainstorm and try to have the symptoms and functionalities selected, and the more important, since this is a large-scale pilot, and the results of the PROCARE4LIFE pilots that have been crucial to the final solution. So let's deep dive in these last three. Can you pass to the next slide, please? So as I was talking about previously, we in the first 9 months of the project, we conducted a mixed qualitative and quantitative study involving with 2 online surveys for patients and carers, 40 interviews, and to key stakeholders like academia, media, decision makers, and 4 workshops for the health and care professionals. With this study, we allowed to bring together the main opinion, thoughts, and experience and feelings of more than 200 users, identifying the users' requirements and needs, and expectations on the use of the technology in the integrated healthcare system. Those are the 2 publications we have already on these. Can you pass to the, yeah, thanks. Simultaneously, as I was saying, we took advantage of the consortium knowledge because the first part was highly impacted by the COVID-19 pandemic. And we took advantage of the consortium knowledge and experience, especially the end users, to define the symptoms and functionalities, which ended up being shortlisted, and here we can find them. For example, we detect bradykinesia, freezing, gaze fascination, loss of balance using the smartphone sensors. Then we have also the wristband. We developed an app for the wristband in order to collect information for falls and for heart rate, but we also use the Fitbit API because this wristband is a Fitbit Versa 2 model to collect other measures like sleep, like inactivity, and so and everything is used to in this sensorial ecosystem. We have also cameras for wandering, and we had the binary sensors for the indoor mobility. The next slide, please. So let's go through the third point, which were the real-life pilots. And we plan to have 3 real-life pilots. So the pilot would be in 3 phases with different objectives. So for pilot 1, we will test the technical feasibility and usability. In pilot 2, characterize and validate system metrics. And in pilot 3, which is the big final test of PROCARE4LIFE, after the PROCARE4LIFE optimizations that come from the previous pilots, we are now testing usability and clinical impact of the final. When I say final, it's the last version of the prototype, and also testing the application to other chronic diseases. Can you move? The pilots take place. Can you move to the other slide, please? Thanks. So the pilots take place in 6 pilot sites all over here, where we have different users and different scenarios. So we have home, rehabilitation, and daycare. Next slide, please. And not going too much in details on the results, but we thought in this session it would be useful to share some of the conclusions that we came from the first 2 pilots, and a very important conclusion was that the PROCARE4LIFE system remained too technological for the target users. We cannot forget that our target users are seniors, are older adults with neurodegenerative diseases. And here we have we put our main challenge in 3 areas. So we have the installation and configuration difficulties, the operation and user-related problems, and the recruitment. So starting with the first one, and some of these, according to what I've been hearing this morning and even in the afternoon, in the vCare project, there were some connectivity problems. There was, for instance, our system architecture was based in a local mini-PC. We had some difficulties in connection with the smartphone, and we had made some progress since pilot 1, and I will talk it later in scalability, but some of the challenges, technical challenges, have been showing that for this particular population, there are things that should be kept as simple as possible. So we had difficulty like auto logout settings that were solved, and even things that the app was too slow. Then we increased the server. Those kind of things were solved, but even though the technical, there were some technical aspects that remained for these 2 pilots challenging. The other point we have here as a lesson learned is related to users and their behavior, because of course it's not all about technical problems. For instance, there are equipment that is being used by the users, of course, and if they do not customize their profile, these will influence the results. If they forget to use correctly the equipments, of course, we will not collecting data. If they left the smartphone in the entrance of their home, and then they go on the opposite side, of course, they will lose the range of Bluetooth and data will not be streamed. So these kind of things happened, and those are that will prevent us to have data. Even for the chosen wristband, we had found some Bluetooth issues reported, and we felt that in our project. So, and the last one, which is the recruitment. I do not need to go into much detail about the impact that COVID had in all the projects, and the general feeling of insecurity that contributed to older adults not being so willing to participate in the study. And here in PROCARE4LIFE, we are talking about a large-scale pilot. So in the end of pilot 3, we should have involved 1,500 users. So it's a lot of users to be involved in. And of course, we know that it was already a challenge, but with the COVID-19, the challenge increased. Nevertheless, we have been finding resilient solutions, and we hope to involve the numbers that we just said about. Okay, the next, and about this topic of scalability, as I said previously, with the technical problems, not the problems, I would say challenges we had. We found in the first pilot phase that the solution was not scalable. It required interventions in the system, and it has to be done on site. And even with the COVID-19 situation, it was even more difficult. So, and to avoid this situation, the technical team developed the system that we call PROCARE OS. So the solution could be as plug and play as possible, and it will allow to have those automatic updates without need to go to patient's home, and configuration via smartphone to easily not have those problems with a mini PC. And it was a good improvement. But in pilot 2, and next slide, please. But in pilot 2, we still had we were increasing, we were learning, and although we have all the functionality proofs, the solution was working, the system remained too technological for the target solution. That was the conclusion of pilot 2. But anyway,
if you have a conclusion, because
yes, sorry. Yes,
out of
can you move to the just sorry for the previous one, just to conclude here, because I think it's a very important one. No, previous, sorry. Yeah. So here, just for the scalability, we thought we'd need to have a simpler solution. So we pass this full system with different sensors. So we can see here the smartphone, the wristband, and the camera, and the binary sensors for a simpler one, which will be tested now, is being tested now in pilot 3, only with the smartphone and the wristband. And directly to the clouds without this mini PC that had some problems. Sorry, can you move to the last one? Integration of okay, just to, it's using the same standards more or less that previous projects talk about. So the contributions we have, needs and requirements, the study we have done it, we think that it would be very interesting for many stakeholders. We can have here the advantages and disadvantages of this system architecture. We have developed we made available the open APIs libraries that we have. And we want to share the lessons learned from the pilots regarding acceptance and usability, and use these events to share the hurdles and the way we have been able to surpass them. For some of you may not have experienced problems, but I think it will be interesting for future projects to not have the same hurdles we had. So thanks. I hope I had.
Very good.